So currently I am a hematologist at Morristown Medical Center in Morristown, New Jersey. Um, I've been very involved with the American Society of Hematology for many years. I am on the committee of practice where burnout has become an issue over many years that we've tried to deal with. I currently am also chairman of the New Jersey State Commission on Cancer Research. So I'm very involved with the Department of Health at the state level, where we fund cancer research for pre and postdocs in the state of New Jersey, where there's also equal amounts of burnout among graduate students. But nevertheless, I would say starting around mid 2014, our committee of practice became interested in physician burnout as defined by mental, emotional, and physical exhaustion, where hematologists could no longer really meet the demands that were put upon them. So, in view of those issues in 2017, where we reach our largest audience, we put on a symposium at the American Society of Hematology annual meeting, which addressed burnout and physician resilience. So we had a panel of experts in 2017, in December of 2017. And one of the panelists was a Dr. Tate Shanafelt. So Dr. Shanafelt was originally head of physician wellness at Mayo Clinic, and now he is a hematologist actively doing research in leukemia, but also is probably one of the national experts in our country on physician burnout, where he's really done the most studies on physician burnout. So he spoke in 2017 at our meeting, and it was in conjunction with Dr. Beth Lown from the Schwartz Foundation, who also, the Schwartz Foundation out of Boston, Mass General, has been very involved with physician burnout. So fast forward from 2017, in 2020, in March, we initiated the dealings with the COVID pandemic. And the COVID pandemic really brought physician burnout to a head, because more physicians were feeling just exhausted physically, mentally. There was a lot of clinical depression. There was evidence of compassion fatigue during and after the pandemic. So then in 2021, the American Society of Hematology, at the annual meeting again, we did another symposium on physician burnout for fellows and hematologists at the annual meeting. So I co-chaired that meeting with Dr. Michael Lindenberger of the Fred Hutch Cancer Center, who was director of fellowship training at the Hutch. And we addressed the issues facing many of the fellows in hematology around the country. And again, it was recognized that burnout was continuing to increase with COVID. A lot of the needs of the physicians were not being met. So I think in 2021, there was a real recognition of this issue, and people looked at the approaches that there were systemic issues that need to be dealt with, that individual organizations need to do something for physician wellness. And those addresses were taken up by, for example, Morristown Medical Center, that hired mental health support psychiatrists to help the staff deal with burnout. In addition, the Summit Medical Group, for example, which I was part of at that time, also hired physicians to give support to those physicians dealing with burnout. So that was in 2021. And I tend to think that since 2021, 2022, the ball has been dropped to some degree by organizations in terms of giving support. So now physicians really deal with other issues such as administrative responsibilities, the need to generate large amounts of RVUs. We have looked at the electronic medical record as a major cause of physician burnout. For example, dealing with Epic has become increasingly difficult for many physicians. Many of my colleagues will see their patients all day, and then will either take their work home or stay in the office well past their normal hours to complete their EMR records. Another major issue, which we've discussed at the Committee of Practice at ASH, are the patient portals. Patient portals requires the physician to be on call, available 24/7. There's always data coming in to hematologists, lab reports, pathology reports, bone marrow reports, and the patients expect an answer. And what's happened is um, because of legislation, many patients find out that they have, let's say, a leukemia or a lymphoma prior to the doctor getting a path report. And often this can happen on a weekend. So patient portals are a very big issue now in terms of increasing burnout, emotional, physical exhaustion among physicians. There are these major systems that really have to look at helping their physicians because physicians in general, hematologists, oncologists, and other physicians are feeling overwhelmed. And it has to be addressed and it can't be ignored. And even though we got through COVID, there will be a pandemic at some point, and we have to be ready for that. And dealing with that means the physicians need to have their needs met by these appropriate systems. I asked one of my colleagues this morning, who's a very busy hematologist at Morristown, how do you deal with it? And several statements. Number one, um, he said, we swallow our grief. And it goes to the idea that hematologists and oncologists tend to be martyrs, and their primary reason is to take care of their patients. And they give themselves up to that. So a lot of physicians tend to suck it up. Um, Another physician this morning, who's a hematologist at the hospital, told me that he felt he was being treated by the administration as a vendor or a laborer. And I think to some extent, nationally, because the corporatization of medicine, there's really almost like a lack of respect for what a lot of physicians do. It's interesting that during COVID, let's say people were applauding what physicians were doing, risking their lives. That in New York, they would be applauding people in the streets, the healthcare workers and providers. Well, that's gone away now. And a lot of hematologists don't feel they're being treated with appropriate respect. Uh, Patient demands are greater. Uh, Often patients are not that grateful, and hematologists feel that. And that further contributes to physicians and hematologists feeling that they're not being respected, um, that they're not accomplishing what they set out to do. And hematology remains a very noble profession. It's a privilege to take care of patients during some of the most difficult times of their lives. And basic respect is what's anticipated and planned on, but it often doesn't happen nowadays. And I think it's being weighed down by all the administrative burdens, the EMR, the patient portals, having to do modules for your respective institutions. Um, so the list goes on. But again, the administrations, the systemic changes that have to occur have to come from the top. Now, physicians can also do self-care on their own, and self-care involves what can you do to stay resilient? Well, you can try to get better sleep. You could try to spend more time with family and friends. You can exercise more. Um, you can seek personal help and counseling. So there's a lot you can do for self-care. But the administration, the leadership from hospital systems really has to address these issues. And there's only so much that physicians can do on their own. My friend this morning, who's a very busy hematologist, said, I certainly could use a scribe. And he said that he's hoping that artificial intelligence maybe at some point can be acting as a scribe. Maybe AI can also be used to help respond to patient portals. If results come in, maybe AI can answer the questions the patients have rather than the doctor having to get on the phone. And the incidence of burnout is equally present among nurse practitioners, among PAs. So it's among the nurses caring for very sick patients. So it's really healthcare providers in general. It's not just hematologists. I think giving up the martyr status really has to be recognized, that hematologists have to address self-care. One thing Dr. Lindenberg and I learned at the meeting in 2021 was that fellows at that time, fellows in hematology were feeling really exhausted by COVID and by their demands of the administrations. And a lot of fellows were looking to go into pharma. So looking for lifestyle balance, a lot of people are leaving the field of hematology and looking for jobs in pharma. And fellows themselves, rather than saying they're going to clinical practice, look to pharma to achieve a better work-life balance. And I think you can't be too proud to not ask for help. I know there's help out there. At Morristown Medical Center, we have mental health care workers available to physicians. They're not used very often. Um, you know, Often asking for help shows you may be a weaker person, but I think we have to get past that. Help is available. If someone is feeling clinically depressed, then you have to seek help. The Lorna Breen Foundation, Lorna Breen was the ER doctor at Columbia in, I guess, April of 2020, who committed suicide. She was overwhelmed. Her family set up the Lorna Breen Foundation, which then helped provide a bill that was passed in Congress to provide mental health assistance for healthcare workers. And over $100 million in funding was provided by Congress through the Lorna Breen Foundation to help nurses, doctors, social workers deal with burnout. So the help is out there, the funding is out there, and we have to take advantage of it.